Hello everyone, good morning and good afternoon. Thank you for joining this webinar about literature searching in health economics. My name is Joyce Cupido. I'm Interim Marketing Solutions Manager at Elsevier and will be your hostess today. Before we start, I would first like to check with our audience if the channel is working correctly and if everyone can hear this. If some people of the audience could type in something in the feedback form, that would be a signal for us that the channel is working. And in the meantime, I would like to mention that this webinar will be recorded and will be available with the same link after this live broadcast. And if you would like to be in touch with us, you can find our contact details on the page of this webinar. We are happy to receive your opinions on the webinar and what other subjects you would like to follow. But now let's start with the webinar, and let me now introduce Julie Glanville, Associate Director at York Health Economics Consortium, and she will be presenting this webinar. Julie will leave lots of time for questions at the end, so if you have questions, you can post them during the session in the chat box. Well, Julie, can you tell us more about your background and later on then start your presentation?
Thank you very much, Joyce. I hope everyone can hear me. Hello, everyone. Good morning, good afternoon, good evening. It's a real pleasure to be able to talk to you today about literature searching in health economics. As Joyce has said, I'm Associate Director at York Health Economics Consortium. This is a consultancy company owned by the University of York in the UK. And as you can tell from the name, we are very much focused on health economics. We carry out health economics modelling, and I manage the systematic review stream of work within the organisation. By background, I'm an information specialist, and I've worked in a range of organisations working in systematic reviews and health economics over the past 25 years. So I've previously worked at the Centre for Health Economics at the University of York, and I've also been an Associate Director at the Centre for Reviews and Dissemination at the University of York, where I managed the NHS EED Database. So I've got quite a long experience of searching for health economics literature and also of managing health economics databases, and I'm hoping to share some of that with you today.
Thank you. You can start with the webinar, Julie.
Okay. Sorry, I'm just trying to figure out how to move it on.
You can see two buttons, back and forward. If you push them, and then you can go to your next slide.
I'm afraid I'm not seeing those at the moment.
Let me help you. We're at the first slide with the overview now.
Thanks very much. Okay, thanks. Looks like Joyce is going to help me today, so thank you, Joyce. Sorry, everyone. We'll move on. So on the first slide, this is just an overview of what I'm going to talk to you about today. In terms of finding health economic studies, I'm really going to focus on finding economic evaluations. These are studies that compare different treatments and look at the different cost effectiveness of treatments. These might be expressed with the sort of terminology cost effectiveness study or economic model, and they're the types of studies that decision makers are interested in to help them assess whether two different treatments one treatment is more cost effective than another. So if we're looking for those types of studies, economic models or cost effectiveness studies, I'm going to first of all talk about what databases we need to search. And then I'm going to talk about the search strategies we might use to find those types of studies. And I'm going to end up with a small section on how to keep up to date in the literature around finding economic studies. Next slide, please, Joyce.
Yes.
So let's think about what databases we need to search if we want to find economic studies. And there are two main types of database. The first type of database is one where the database producers have tried to identify the economic studies for us and have tried to provide a value-added resource which only contains economic evaluations. So there are a couple of databases like this, and I'm going to talk about those in a moment. The other place where we can find economic studies, health economic evaluations, are the big bibliographic databases like MEDLINE and Embase, and I'm going to talk about how we could search those efficiently after looking at the specific health economic evaluation databases. Next slide, please. Yeah. So there are a range of health economic evaluation databases available where people have tried to save us time and effort by searching for economic evaluations and putting them into a database. So why do we want to search these? If we are undertaking health technology assessments, which is a type of research looking at the effects and safety and cost effectiveness of new treatments in healthcare, then we might want to just focus on health economic evaluations, and to help us produce the technology appraisals, technology assessments, we might want to save ourselves time and effort by using these particular health economic evaluation databases. Likewise, if we're doing systematic reviews, these databases might help us search more quickly and more efficiently. They may also be specified as databases that you have to search in order to undertake a comprehensive search if you are submitting your research research to a particular body. So they may be a minimum resource requirement for particular types of project. So they're very useful for systematic reviews and health technology assessments that aim to be comprehensive. They're also useful for pragmatic projects. If you need to do a very quick search to find relevant economic evaluations, these health economic evaluation databases are obviously going to be the best place to look, because you don't have to sift out all of the other non-economic studies that you might find if you just searched MEDLINE or Embase. So for pragmatic projects, these databases are really efficient tools. The value of these health economic evaluation databases is that they're relatively small and they focus just on economic evaluations. So they enable you to do quite broad, simple, quick searches. The other value of these databases is that they might have added value. So often the database provider will add extra information than you might typically expect to find in a database abstract. So they might add a critical commentary about the quality of the study, or they might extract data from the study that isn't in the abstract and give you an early sort of view on whether the study is relevant to your requirements. So these small health economic evaluation databases are often useful because of the value-added information they provide, the extra work that somebody has done to give some extra information to you to help with your work. Next slide, please. Yeah. So I'm now going to talk about some of the economic evaluation databases. The first one is the NHS EED, the NHS Economic Evaluation Database. And this has been for a long time a key health economic evaluation database and has been widely used around the world. It was produced by the Centre for Reviews and Dissemination at the University of York and was funded by the Department of Health in the UK and by our National Institute of Health Research. The database was closed in 2014 and is no longer being updated, but it is still available to search for free. Next slide, please. Yeah. It has records for over 15,000 full economic evaluations of health and social care interventions. And the added value of records on this database are that they contain very detailed, structured abstracts of the papers. So they bring out a lot more detail than you get in a typical abstract. They're very, very detailed. They are also evaluative. They look at the quality of the economic study and they highlight the strengths and weaknesses of the study. And these abstracts were written by health economists, so they are written from the perspective of experts in the field. And as well as structured abstracts, there are also some records that are just the bibliographic details of economic evaluations. This database was built by carrying out regular searches of many databases and also by screening health technology assessment reports and by hand searching major journals like the British Medical Journal. And there were no language limits applied. And as I've mentioned, the added value of the database is that there's a large, more than half of them have these extensive summaries. Next slide, please, Joyce.
Yeah.
So there's 15 years worth of information on the database, but unfortunately it's no longer being updated. So why are we going to search it? Why might it still be useful? Well, I guess it's obviously not going to be current, but and we need to worry about how we're going to capture studies that have been published since 2014. But for studies published before 2014, for the next sort of 5 years at least, I think that the information that is in there is still useful and current and has value. So it's still worth thinking about the NHS ED database, particularly if you're doing pragmatic, non-systematic searches, as a quick place to find published economic evaluations. Next slide, please, Joyce.
Yeah.
So the NHS EED database is available free of charge. Anybody in the world can search this database, and it's available from the website on the screen, from the CRD website. It has reasonable search functionality, in fact very sophisticated search functionality compared to many databases. So you can do searches involving Boolean operators, you can use proximity operators to focus your search, it offers truncation, all of the records have mesh indexing, and you can do set combinations. So for a small database, it's actually quite sophisticated in what you can do as a searcher. It's also got good export functions, and it offers you filters that will enable you to export the records from NHS ED and load them into bibliographic software such as EndNote or Reference Manager. So it was very much built and designed to enable people to use the information in the database easily and get the records out and into other software. Next slide, please, Joyce.
Yeah.
So that's the NHS ED database, but that's not the only database that's collecting economic evaluations and making them available to us. Another key resource is the CEA Registry, the Cost Effectiveness Analysis Registry. And this is produced by the Centre for the Evaluation of Value and Risk in Health at Tufts Medical Center in the USA. Now, this is an open database, but it's also available for a fee. So more sophisticated searching is available for a fee, but anybody can search the sort of basic interface for free. Next slide, please.
Mm-hmm.
So the CEA Registry focuses on cost utility analyses. Now, these are a very particular subgroup of economic studies. These look at these report studies where the results have been presented as cost per quality adjusted life year or similar. So the cost of each of the treatments being compared is presented as a cost utility analysis. So it's different from a cost effectiveness study or a cost benefit analysis. So these are like a subgroup of economic studies, but these are the types of studies that are increasingly required by reimbursement agencies who are interested in cost utility, so that they value cost utility analyses because they try and measure the cost benefit using a common measure. So the CEA Registry contains over 5,500, in fact it's actually over 6,500 cost utility analyses on a wide variety of diseases and treatments. And the added value of the CEA registry is that the database providers are extracting the cost-utility ratios from the studies and are reporting them in the database. So this means you don't need to go to the database for go to the original records to get a very quick assessment of what the cost effectiveness of the intervention is. It will be there in the database record. And it also reports utility weights. Now, utility weights are useful because these are the measures that are used in the economic evaluations to provide the health status value of particular states of disease. And these are really important in economic models. And what the value of this database is that the utility weights, which a study may contain quite a few utility weights, they're all extracted from the study and reported in the database. So again, it helps you to get a very quick sense, a very early sense of whether a study is worth obtaining. And it also gives you the values of those utilities so that you can very quickly see a sense of how people are expressing their sense of a particular health state. It's an open database, i.e. it's free to search, but it does have a time lag. It has, at the moment, data up to 2016. When I first wrote these slides, the data weren't available for 2016, but they are now available. And the content for this registry is obtained from searching MEDLINE. There is a focus. It's limited to English language cost effectiveness analyses, which measure health benefits as quality adjusted life years. So there are many other economic studies out there that do not measure the benefits in these ways, and they will not be in the database. So if you're interested in other types of economic measure, you need to look elsewhere. This is very specifically cost utility measures. And obviously it has really useful added value in the fact that it's extracted these data, the cost effectiveness ratios and the utility weights from the articles. Next slide, please, Joyce.
Yeah.
So you can access the CEA registry from the website I've just listed, and at the top of the screen from the Tufts Medical Centre. They've just revamped the website, so it's looking very modern now. But I think, as far as I can tell, the searching process is still the same. It has a rather basic search functionality. I've called it very poor here. It doesn't let you do more than really search for single words. There are no Boolean operators available, so you can only do quite simple searches. But then, of course, this is a very small database, so it's perhaps not such a problem that you can only search for single words. But it does mean you have to think quite carefully about your synonyms and make sure you use all the synonyms that you might need to use, because it's not going to help you by doing any behind-the-scenes searching. It's very sort of basic. It does appear to support automatic truncation, but again, I wouldn't necessarily rely on that. I would just try and use as many synonyms as possible. And I think the results are limited to the first 100. I haven't checked the new interface. I was only sort of reviewing it again today, and I've been surprised by the new interface, but I don't think it will let you view more than the first 100 unless they've really changed the underlying search options, which I don't think they have. And there's no export, or there was no export functionality. Next slide, please, Joyce.
Yeah.
So the CEA registry is a really useful collection of cost utility analyses. It's free to access, but unfortunately it has a poor search and result exporting option. But it does include very useful data. It is not, however, a comprehensive database of economic evaluations. It concentrates on a subset of economic evaluations that measure health effects in terms of quality adjusted life years. Health economists will find it a very useful way to identify utility weights and but obviously when you're using it, you need to be aware that it's not comprehensive for a number of reasons, time lag, and also the fact that it's only being populated from MEDLINE. Next slide, please, Joyce.
Yeah.
So another database that focuses on economic evaluations is the Pediatric Economic Database Evaluation, and this is abbreviated to PEED, and from that you can obviously pick up that this has focusing on child health, and it's being produced by the Research Institute at the Hospital for Sick Children in Canada. And again, it's a free to search database. Next slide, please, Joyce.
Yeah.
So the PEED database contains information on over 3,000 full economic evaluations that are relating to child health. And just like the CEA Registry, they are focusing on health state utility weights, and they're collecting them from cost utility analyses, and they're making them available in the database. So this is a very useful added value, again helping you to decide whether an article is worth purchasing. Basically, you can see whether it's worth purchasing because you can actually see if it's reporting utility weights. It's an open database, but like the CEA Registry, there is a time lag, and it currently contains content from 1980 up to 2016. So the information, the records tend to get added in batches, and it's not as current as one might hope. However, it is obviously free. They seem to search more widely than the CEA Registry. They search multiple databases, websites, and reports to try and find studies that are eligible. And they focus on English language abstracts or text. And they also, again, are focusing on adding value by extracting key aspects of the study, such as which analytic techniques were used and the utility weights where they're reported. Next slide, please, Joyce. Yeah. So you can access this free online from the website listed there. Again, the search functionality is quite basic. You can do very simple searches. You have the Boolean and available, but not or. So this again points you to the fact that you're going to have to do sort of multiple searches with lots of synonyms to make sure that you don't miss studies. And again, there is an automatic truncation option, but you might want to just test that out to make sure it's really working as you hope it would work. Unlike CEA Registry, you can export the results quite easily. Thank you, Joyce. Next slide. Yeah. So the PEED database is a collection of economic evaluations relating to child health. It's free to access. It has basic search functionality, and it has very useful data from the studies in a summary form, but it does suffer from a time lag, so that you would need to fill in the last 2 years by searching some of the large bibliographic databases, which I'll talk about next. Next slide, please. Yeah. So the large bibliographic databases that we probably have to also search if we are going to be comprehensive and current are MEDLINE and Embase. And when we're searching these databases, what we're probably going to want to do is to build a search that involves searching for the subject, so the disease and the population of interest and the disease of interest, and then adding on, using the AND operator, an economic evaluation filter, a set of search terms designed to find economic evaluations in these large biomedical databases. You might also, if you're interested in more than economic evaluations, if you're interested in costing studies or cost of illness searches, then you might look for a costs filter to add onto your subject search. So with these large bibliographic databases, the number of economic studies represented in those databases is actually a tiny proportion of the database. So you really do need a search filter to make sure you're not looking at many irrelevant studies. Next slide, please. Yep. So what are search filters? If you're not familiar with search filters, these are search terms or search strategies that identify a specific topic or aspect of research. So we might find search filters for study types, such as economic evaluations or utility studies, or we might find search filters, and we also find search filters for things like age groups. So you can find search filters for children or the elderly. And these are strategies that have been developed, often using research methods, to work in a particular way and to have a particular performance, so that we can treat them as tried and tested strategies that we could use in a variety of situations and be reasonably reassured that they will always sort of work in the same way. And routinely, we see them combined with other searches. So we see them combined with, for example, in the example you can see on the screen, you might combine an economic evaluation filter with a disease such as breast cancer and perhaps the intervention you're interested in, maybe tamoxifen in this case. The other thing about search filters is that they are usually designed for a specific database. So researchers, information specialists will design a search filter to reflect the particularities of a specific database. So a MEDLINE search filter for economic evaluations might look quite different to an economic evaluations filter for Embase, because the filters will make use of the subject headings and the different subject headings that are available and the different ways that indexers index economic evaluations in the different databases. So it would be, you'd have to be quite careful about translating a filter that was designed for MEDLINE to use in Embase. Next slide, please, Joyce.
Yeah.
So why do we need to know about these search filters? Well, I hope it's sort of, you've picked up, obviously, that the major database that was recording economic evaluations has now ceased updating, and another database that paralleled the NHS EED database, a database called HEED, has also disappeared recently. So these were really useful value-added resources, but they're not being updated prospectively. And the other databases that are available, the CEA Registry and PED, are not current and are also quite selective. They focus on utility studies. So in that situation, we are probably, if we're doing searches where we have to try and be comprehensive, we're probably going to need to search for economic evaluations in the big databases, such as MEDLINE and Embase. And what's generally seen as acceptable is to use search filters for economic evaluations that have been made available through research efforts by other people. So it's quite acceptable by many reimbursement agencies and quite acceptable by many systematic review practitioners to use published search filters to find economic evaluations in the big databases. These are seen as standard approaches. And they are also standard approaches that we can cite when we write up our searches and write up our reports. We can say we used, for example, the NHS ED filter to search MEDLINE, or the NHS ED filter to search Embase. Next slide, please.
Yeah.
So how can we find out about search filters, which search filters are available? One of the main places you can identify search filters is a website called the Intertask Information Specialist Subgroup Search Filter Resource, and this is a website that I maintain in collaboration with Kath Wright from the Centre for Reviews and Dissemination at York and Carol Lefevre. And the Search Filter Resource offers search filters for many types of research design, but it has an economic evaluation section, which I've listed on the slide there, and this is where you can identify economic evaluation search filters. And as well as the search filters themselves, you can find overviews of filter performance, and these overviews are assessments that third parties have undertaken to assess how well search filters perform. And these are the things you probably need to read first rather than the actual individual filter studies, because these will tell you which filters you might want to try. Next slide, please, Joyce.
Yep.
So if you want to find the types of studies that were included in NHS ED, then one of the approaches might be to use the same strategies that the producers of NHS ED used to populate their database. So this means that you would be following the same pattern as the producers of NHS ED. So I'm going to show you on the next slide these NHS ED search strategies and suggest some slight adaptations that you might want to make. If you don't want to adopt that approach, there are other filters available on the website, on the ISSG Search Filter Resource webpage, and there is also an overview that I undertook and published in 2009, which compared the performance of a whole range of search filters. And so if you're not happy with the NHS ED filter, then this report here, where I'm the first author, produced for the Canadian Agency for Drugs and Technologies in Health, even though it's dated 2009, we know from recent testing that the findings are still pretty much the same. So this will give you some other insights into other filters that you might like to try. I'm now going to move on to talk about the NHS ED filter and how you might adapt it just to, if you wanted to use it in MEDLINE and Embase. So next slide, please, Joyce.
Yeah.
So this is the NHS ED filter for MEDLINE, and I've color-coded it so that you can see the various parts of the filter in case you're not familiar with filter design. So the red search lines, sorry, I've missed the one off of the first one. The red search lines are the headings and the text words that are likely to bring back records that report economic evaluations from MEDLINE. And these are all combined in line 12. We then move on to the sort of grey terms. Now, these are terms that a lot of people see, and they see in a strategy, and they're not quite clear why they're there. Now, what we found when we were developing this filter is that there were a lot of irrelevant records being produced about energy cost, metabolic cost, and oxygen expenditure. So these were words where cost and expenditure were being used in a context we weren't expecting. So these terms are mentioned here to be excluded. So what happens is we search for them and then we exclude them from the results produced by the red terms. So that's what's going on in line 17. These irrelevant records about energy and metabolic cost are being removed from the set of results. The search lines in yellow are particular types of publication where we rarely get results being published. So letters, editorials, and historical articles. We rarely get results published in these. So this is, again, a set of records we're going to exclude. And they get excluded from the red results in line 22. Line 23 in green is the typical MEDLINE animal strategy, and this is a safe way to remove animal studies from your results. So that's another way of removing irrelevant studies. And then the set of purple lines are a feature of this strategy that was important to the producers of the database, the NHS ED Database, because these are publications that they would hand search. So if you're running this filter in MEDLINE yourself, you wouldn't want to exclude those lines in purple because they do actually contain records you might want to look at. So the purple lines, I would suggest you want to remove from your strategy. So the revised strategy that I'm sort of suggesting might work well for us in MEDLINE is on the next slide, please, Joyce.
Yeah.
Sorry, this is an explanation of, just so you've got the notes for some if you want to read these again. So if you could go to the next slide, Joyce.
Yes.
Thank you. Lovely. Okay. So this is a cut-down version of the MEDLINE strategy to focus in on just the things that you really need as somebody who is not producing an economic evaluation database. So you as a searcher might prefer to use this cut-down, or as I called it, adapted version. So what this does is it searches for the terms that are likely to identify economic evaluations in red. It removes the noisy records about oxygen cost and energy expenditure in sort of grey, and it also removes the animal studies in green. And then it combines the results in line 18. If you also wanted to, you could also remove the publication types if you felt that was helpful in focusing your search, but I haven't sort of suggested that here because I think that's something people need to think about. Next slide, please. Yeah. So this is the same idea, only this is the NHS ED filter for Embase, also adapted. Now, the difference with the Embase filter from the MEDLINE filter is that there isn't really an accepted way to remove animal studies in Embase. There's not a simple approach like there is with MEDLINE. So this is one way to remove animal studies, lines 13 to 21. This is one way to remove animal studies, but there are probably lots more different ways of doing it. So many searchers will have their own preferred way of removing the animal studies from Embase. So I'm suggesting this here just because it's consistent with what NHS ED has done, but you may have your own preferred way of removing animal studies. But you will see here there is also the metabolic costs being removed, but the subject headings for the health economics studies is different from MEDLINE. Also, as you probably know, Embase has many, many more conference abstracts than MEDLINE. So again, whether it's a decision that we make on a case-by-case basis, whether we're going to include or exclude the conference abstracts. So in some cases, particularly for economic evaluations, you may not get the full detail you need for an economic evaluation in a conference abstract. So often we wouldn't search for them, but then in other situations we want to know about them. So the conference abstract inclusion exclusion decision is highlighted there in red. Next slide, please. Yeah. So again, this is just a description of what you've seen on that slide, just in case you can't remember what I've said verbally. Next slide, please. Yeah. So as well as looking for economic evaluations, and economic evaluations might include cost utility studies, cost-benefit studies, cost-effectiveness studies, economic models of other types. Another thing that researchers often want to search for, particularly when they are creating economic models in the healthcare situation, is they want to find these utility values, how people value particular states of health. And utility studies are quite hard to identify because the terminology is not standard, and people use lots of different instruments to measure utility, and they describe their research in many different ways. So until recently, there wasn't a search filter to identify utility studies particularly, but we've recently, at York Health Economics Consortium, we've recently developed and published a filter to identify utility studies. So this is now in print, and I'm just sharing you here the 3 filters that we've developed, which you're welcome to use if you find these useful. So this is the sensitive filter, and on the next slide, please, Joyce. Yeah. You've got a sensitivity and precision balanced filter. So the previous one was if you were wanting to find as many relevant studies as possible. This filter is sensitivity and precision balanced. So if you're in a bit more of a hurry, you want to sort of be a bit more focused and you don't mind missing a few studies, this is the sort of filter you might use. And then the next slide, please, Joyce. This is the precision maximizing filter. So this is if you're in a real hurry and you just want to focus in as quickly as possible on utility studies. And you do this in the awareness that you might miss some studies. So there are 3 options there, depending on how busy you are, what the purpose of your search is for these utility studies. Next slide, please, Joyce.
Yeah.
So I've talked about health economic evaluation databases. I've talked about the main large bibliographic databases that increasingly we are going to have to search because of the nature of the available health economic evaluation databases. And I've talked about search filters to find economic evaluations and utility studies. There's quite a few useful overviews of searching for economic studies, and I've just listed some here. If you're new to this area and you'd like to learn more about searching for this type of information, these resources are hopefully very brief but useful introductions to the searching challenges for these types of studies. And the next slide, please, Joyce.
Yeah.
And if you're going to be searching for these types of studies regularly, or if you only search for them intermittently and you want a quick reminder of what's best practice because you haven't searched for a while, then I would like to point you to a resource called Sure Info. This is a resource for information specialists who are doing health technology assessment, and it contains information about how to do the searching for different aspects of health technology assessment. And one of the chapters, of which I'm a co-author, is a chapter called Cost and Economic Evaluation. And every 6 months, we trawl through new research about finding economic evaluations, and we update this chapter to incorporate the best research evidence on how you identify economic studies to do health technology assessment. It's very brief, it's one side of A4, and it's all fully referenced. The other ways to keep up to date are to check out the major conferences in HTA, including ISFOR and HTAI, and to look out for journal articles and HTA reports. And if you could just go to the next slide, please, yeah. Joyce, which I think is my final slide.
Yeah.
So I think we've come to an end. There are a range of databases capturing economic evaluations, although they all have their limitations. I think increasingly we also have to search MEDLINE and Embase. We do, however, have a range of search filters we can use, and I think that keeping up to date in this field is relatively easy. Thank you very much.
Okay. Well, Julie, thank you for this webinar, and I am going through the questions we received, and I will ask them to you. Do you ever find utility in searching positively for health economics journals as an adjunct to using subject or free text terms?
That's a really good question. I mean, you would expect, wouldn't you, economic evaluations to be published in health economics journals. So you will find quite a few there, but health economic evaluations are also published in sort of clinical journals as well. So they're not only published in the journals you'd anticipate, they're also published in many specialist clinical journals as well. So if you run the risk of missing economic evaluations if you only focus on the economic journals.
Okay. And for the Embase filter, can't we use the quick limit for humans?
I don't know. What we find with economic evaluations is that often, particularly in MEDLINE, they don't put humans as an indexing term on them because they are economic evaluations. Now, I don't know what Embase does. I don't have a feel for whether it's a reliable thing to do to use the quick limit for humans. So I suggest experimenting. I tend not to use the humans limit because I'm never sure that things that are economic evaluations will be. You can expect humans to be tagged in clinical papers, but I wonder whether you will also see all those economic evaluations having the humans tag as well. I don't sort of feel safe at the moment that they do.
Okay, thank you. Can you name a few journals that can be looked into?
I think Health Technology Assessment is a really good journal. Now, Health Technology Assessment is produced by our National Institute of Health Research in the UK, and they publish systematic reviews and economic models in a large number of areas, and that's a really good journal where you get a lot of economic studies. But a lot of journals, as I said, you can expect to find economic evaluations in a whole range of different journal types. So you'll find them in general medical journals, in specialist medical journals, and you'll find them in health economics journals, and you'll find them in health journals about health promotion, about health policy. So unfortunately, they're not all neatly in one place. That's one of the challenges of finding them easily.
Okay. This is a question from Marcela Ramos. She's an academic researcher from the University in Sao Paulo, Brazil. Her question, in my institution, we don't have OVID interface available for searches in databases. As the gold standard is to use published filters, which would be the best option for those who need to search for MEDLINE via PubMed and Embase out of OVID interface? I'm aware that some agencies have a HEE filter for MEDLINE search via PubMed, but not for Embase. Long question.
Yeah, no, is it Marcella? Yes, Marcella, that's a really good point. I've recently been translating an RCT filter from Ovid Embase to Embase.com, and I thought it was going to be straightforward, but it really wasn't, and it generated all sorts of issues that I'd never come across, and all sorts of strange things happened. So I would suggest if you are going to do translations that you do them very carefully and that you test them out, especially if you're going to reuse them. I would invest some time in doing a very careful translation and testing them out to see that they work in a way, the same way they did in the other interface. And then only when you're happy that they are working in the same way, then go with what your translation looks like. But my recent experience is that translation seems relatively straightforward, but really isn't. And for all sorts of reasons I would never have expected. I've been writing this up recently, and I'm hoping to get it published. But it generated all sorts of strange things that I just never expected. So, as I say, if you do translate, do it really carefully, test it out quite a bit, and then only when you've tested it, then go with it live. Just be cautious.
Okay. How do you handle the problem of questionable or predatory publishers of research? What criteria do you use to identify reports in questionable journals?
That's also a really good question. I'm sort of assuming, my understanding is that MEDLINE is being very careful in terms of the journals it's indexing. And I'm assuming that Embase is the same, that it's being very careful in the journals that it's indexing to minimize our exposure to predatory journals. However, in the field that I work in, we're undertaking systematic reviews. So as part of the systematic review process, we critically appraise every study we look at. So I guess our anticipation is that the process of critical appraisal, the process of double reviewer extraction and quality assessment will hopefully highlight any studies that are not well reported or are reported or might have results that are questionable. So it's part of the. I think we're picking that up at the further down the review process than at the search stage, and we're sort of hoping that MEDLINE and Embase are protecting us to a certain extent from exposure to these journals. I don't know if that's a thing that I should be confident about or not.
Let me have a look if there are more questions. I think No, there's not more questions anymore. Well, Julie, that makes us at the end of this webinar, which was very informative. Thank you very much for this. Thank you, audience. This webinar, you can have a look at it again after we finish it. It will be downloadable, and the slides are also downloadable. For now, Julie, thank you for presenting, and we saw some people asking if you wanted to do more webinars, so maybe. And well, let me thank you and say goodbye to you and the audience then now.
Thanks very much. Thank you, everyone, and thank you for such really interesting, useful questions. Thank you.
Okay.